Good afternoon, everyone. My name is Maloney-Johns. I am faculty at the Physician Assistant Program here.
And I'm Katie Fortenberry. I'm faculty in Family Medicine Division, Department of Family and Preventive Medicine.
And we're going to present to you about promoting primary care career choice in PA students. The mission of the University of Utah PA program is to train students in a primary care model to be able to provide high quality care to rural and underserved populations. That not only comes from the root of our profession, but also where we live. In Utah, at least 15 rural and low-income counties are considered health profession shortage areas. And PAs are uniquely trained to be able to fill those gaps fairly quickly in these rural and underserved areas. That's actually the basis of which our profession was actually founded. So Utah is a really good place for that, and it really aligns well with the mission of our program. But for various reasons, not all of our graduates go into primary care. We usually have between 30 and 40% of our class go into primary care upon graduation, and we wanted to be able to encourage a few more students to be able to go into primary care. So in 2019, the PA division received a AHSE grant, and the whole idea behind the AHSE grant was to promote additional primary care training. One of the objectives within that grant was actually to create a scholarship program for students who were interested in an enhanced primary care training experience while in their clinical year and in school. So all of our students were encouraged to apply, but the scholarship program consisted of a $10,000 scholarship for each student that was selected, and an enhanced primary care training experience, which essentially meant they would get an additional 8 weeks of primary care training in addition to the already fairly robust primary care training we have in the program. The additional 8 weeks comes in place of their elective rotations. So every student is able to choose 2 4-week elective rotations in their clinical year. So their electives became additional primary care. Additionally, we looked at students who were willing to complete a community engagement project with a community partner, as well as a verbal agreement to work in primary care. There was nothing legally binding about it, but a verbal agreement to say, yes, I have an intention of working in primary care upon graduation. Preference was given to students from disadvantaged or minority backgrounds, to veterans, to people, again, who had a genuine interest in primary care, and also those with financial need. So our first cohort of scholarship recipients was given in January of 2020, and we selected 8 students. 4 of them were put in a rural track, which meant their additional primary care training was in a rural environment. And 4 were placed in an urban underserved track, which meant those 4 were doing their enhanced training in an urban underserved environment. And those were basically based on interest in students who wanted to go into rural areas and wanted to go into urban underserved areas. So the results here initially show our demographic characteristics. So 7 of the 8 students who were selected were from disadvantaged backgrounds, and 6 of the 8 of them were diverse. In terms of their rotation outcomes, all 8 of them completed the enhanced primary care training that they had agreed to, and all 8 also completed the community engagement project that was with one of their clinical partners in the clinic that they were placed in during their clinical year. All of the students in our program are required to do at least 1 4-week rural or underserved rotation. And what this shows up here is that in comparison to the average PA student. So our scholarship awardees on average did between 5 and 6 rural or urban underserved rotations, and of their total 11. So about half of their total rotations were either in rural or underserved locations, which is great, which is significantly more than the average PA student. And then we wanted to see, did this actually matter in the end? Where did these students actually go? So this cohort, this was our first cohort that did this, and they graduated in August of 2021. So we tracked them, and as of today, 7 of the 8 of them are working in primary care, and 7 of the 8 are working with underserved populations. So everybody in primary care is working with an underserved population, which is great. The other interesting thing we found is 3 of them are actually working in clinics where they did rotations in school. So they were offered jobs before they even graduated in those clinics, which is great. From a pipeline standpoint, that's exactly what we love to see. So ultimately, with this first cohort, we did see that enhanced training and a scholarship that went directly towards their tuition did encourage PA students to enter careers in primary care. So we have 4 cohorts total that will be part of this grant. This reflects the first, but we're very hopeful that the other cohorts follow this trend. So, what questions can we answer? Okay, yes.
I have an additional, I was part of the AHSE that we did at the College of Nursing and unexpectedly found out how expensive it was to house students for, you know, all the hours.
Yeah.
We had, what, 8 weeks rural? Did they commit to stay down there? Did you have to pay them coming back and forth?
That's a
Did
great
grandmother
question.
die?
Yeah, that's a great question. So,
Did the motel not work out?
yeah, no, that really matters. Yes. So that's a wonderful question. And so the $10,000 was their scholarship that went directly to their tuition. We also built in housing costs into the grant for those students to be able to spend that additional time down in those rural areas. So that really applied to 4 of them because the others were urban underserved. We were able to keep them in Salt Lake. But the 4 that went rural, we were able to subsidize their housing. We worked with AHEC in terms of finding the housing, and then the grant funded that housing. But very good question. Yes?
Are you guys doing, like, as they graduate from the program, exit interviews to figure out, like, how much that money changed, whether they were doing primary care or not? Or did it, like, help the students who are already committed to doing it more? And then also, like, thinking about, like, 10 years from now, like, the longevity of a career in primary care and whether this helped to offset, like, the financial cost or risk of going into a primary care.
Yeah, that's a great question, and actually you bring up a good point that we should really do that question a year or 2 later, because the response for them, you know, initially is of course it helped encourage me to do this, but that's pretty much right at the time of graduation. A year or 2 down the line, or 5 years down the line, that would actually be a really good question to ask. Yeah. So that actually we may add that to the cohorts we have left. So thank you for that.